My dear students, today I'll be talking about malaria, a very important and a very common infection that come across in the general practice. My dear students, do remember malaria is from the word mal area, that is a disease of bad sanitation. Are you getting my point? A disease of bad sanitation. Wherever there are mosquitoes, due to that pull of the water, sewage water, or any other pull of water, there is survival of these mosquitoes. For malaria, you need female Anopheles mosquito. This is important. Female Anopheles mosquito is a vector for this parasite. These are also known by the name vector-borne diseases. These are also known by the name vector-borne diseases. Are you with me? Are you with me? Now, before going into the detail, I should tell you about malaria one thing that I always tell to my students. All of you know the Alexander Sikandar. He died of malaria while returning from India. Are you getting my? He died at the age of 32 by a relapsing fever. That is what is mentioned. Because at the time malaria was not a diagnosis available. And that's why it was written there while he was in back journey to Greece. While he was on the back journey to Greece, he died of relapsing malaria, and he was returning from India, all of you know. Yes, it is very true that malaria is a dangerous disease seen in India and it killed Alexander. Don't take malaria lightly. That is what I am trying to tell you. Getting it? Yes. Now, very nicely it has written here. It is a febrile relapsing illness. Febrile relapsing illness. Am I right? Yes. Characterized by shaking chills, anemia which will develop subsequently, and the last thing is splenomegaly. It develops after 1 week. It develops after 1 week. Am I right? It's a disease of bad sanitation. Fever with chills is the presentation, that is relapsing. Relapse of the malaria. Now, I will be talking about the causative organism, and that is Plasmodium and its 4 species. Plasmodium vivax, Plasmodium falciparum, Plasmodium ovuli, and Plasmodium malariae. Out of which, 2 important things I should tell you. The most dangerous form of malaria is this Plasmodium. Most of the deaths of malaria are due to Plasmodium falciparum. Maximum deaths of malaria are due to Plasmodium falciparum. Are you with me? Yes. Then, Vivax and ovuli are the 2 forms of malaria which show relapse of malaria. Relapse of malaria, what I mean to say, that today I gave medicines to my patient say get cured. For 2 months there was nothing, and after 2 months again malaria is there. That is known as relapse of malaria. Because these 2 forms, Vivax and ovuli, can produce spores. We call them sporozoites. And those spores can develop later also. Yes. We call them sporozoids, hypnozoids, sleeping. The word hypno is related to sleep. I mean to say they are just sleeping there. And that's why the words are hypnozoids. So these are the important things related with malaria. Now, the next. Life cycle of malarial parasite. Now, I will not follow whatever is written here. I will follow what is important for you. Okay? I have started, it's a cycle. And that's why it can be started from any place. But before going into detail, I should tell you that only female Anopheles mosquito can cause malaria. Only female Anopheles mosquito, female infected Anopheles mosquito can cause malaria. Now, if such infected Anopheles female mosquito is going to bite me, it will put the spores in my body. Getting my point? Now, these spores are trapped immediately by liver and they develop inside the liver cells, that is hepatocytes. In the hepatocytes, they first multiply and then mature. And now they are known as merozoids. Now they are known as merozoids. At a specific time, these all cells, that is hepatocyte, they burst. And all merozoids come in the blood. When they come to the blood, their name becomes squeezons. Their name becomes squeezons. S-C-H-I, spelling. Initially, they were spores. After multiplication, maturation inside the hepatocyte, they become merozoids. Now these merozoids are there in the hepatocyte burst, and these hepatocytes are going to release these merozoids in the blood. The blood form of the merozoid is known as squeezone. Now, when they are there in the blood, these squeezones are there in the blood. That is a time, that is what we call parasitemia. What we call it? Parasitemia. And this is the place where, this is the time where you get fever with chills. Where you are getting fever with chills. Getting my first point? Yes. That is what we call clinical attack of malaria. Fever with chills. Now, next sentence is very important. Within half hour to 1 hour, these squeezons immediately pass to RBCs. And when they pass in RBC, this clinical attack of malaria goes back to 0.0. That is, all his fever and chills will go off. And that's why fever and chills in malaria remain there for half hour to 1 hour. Thereafter, this squeezone enters the RBCs. And within RBC, it gets converted into male and female gametes. Now, point is important. These RBCs are not normal RBCs where this squeezone entered. Because of entry of the squeezone, they will be get marked. This is not a normal RBC. Are you getting my point? Now, this RBC now contains male and female gamete because that squeezone get converted into male and female gametes. Now, while passing through the spleen, it will be recognized that this is a wrong RBC. Something wrong with this RBC, and that's why it will be killed. It will be killed. Hemolysis will take place. And because of this hemolysis, those male and female gametes produced inside the RBC now will come in blood. And this is how now the blood is containing male and female gametes. Getting my point? Clinical attack of malaria took place. Now what I am having? Male and female gametes. Fortunately, these male and female gametes are not going to produce any disease in myself. But they are very essential for continuation of life cycle of malarial parasite. Now what will happen? A non-infected, point is important, a non-infected, another female Anopheles mosquito will come. And that will bite to me. Now that new uninfected female Anopheles mosquito will suck the blood from my body, which is containing male and female gametes. Now, in the saliva of the mosquito, there will be fusion of male and female gametes. In the saliva of the mosquito. There will be formation of zygote in the saliva of the mosquito. And that zygote will move to the stomach of the mosquito, where it gets embedded. Again their multiplication and maturation of those cells will take place. And that will be converted into tiny spores. Now at one point of time, all this structure in the stomach will burst. And now those tiny spores will come in the saliva of the mosquito. Now this mosquito is able to infect the next individual till the end of its life. That mosquito can infect next human individual till it exists. That is a lifetime infection of that mosquito. That female mosquito will continue to infect the next individual till it dies. Getting my point? Are you getting my point? Now, there are serious issues. Whatever the drugs we use, maximum drugs act only on the blood forms. That is, the squizontocidal drugs we are having. The drugs will act when the parasite is there in the blood or in the RBC. The drugs don't act on the gametes. Drugs don't act on hepatic phase. Are you getting my point? Are you getting my point? Yes. And these are the serious problems. Only primaquine-like drugs are there. Those cover the pre-erythrocytic phase, that is the hepatic phase, and exoerythrocytic phase means the gametic phase. Otherwise, chloroquine, mefloquine, sulfadoxine, pyrimethamine combination, artesunate, artemether, artether, or whatever the drugs you know, all will cover primaquine. Primaquine is covering the pre-erythrocytic and exoerythrocytic. Except primaquine, all the drugs are acting on only blood forms. And that's why my sentence is important. Whenever you treat malaria, you treat only the blood forms. And that is what you cure the patient. It's clinical cure of malaria. Now she is thinking, sir, how can I eradicate malaria? You can eradicate malaria only if you are having two points. One, you should kill in the hepatic phase, and the most important, you should kill gametes. If you kill gametes, then you can stop the spread of malaria. You can restrict malaria in that individual only. And that is the function that has to be brought about by primaquine. Primaquine is a drug which is active there. Now, I think I should repeat the cycle once, so that some latecomers are there. They are totally confused. I should tell them also, okay? And it will be good for all of you also. Now, I will start again the same. An infected female Anopheles mosquito bites to Dr. Joshi. It will release the spores in the blood of mine. Those spores will be trapped immediately by our liver, that is the hepatocytes, and they will multiply and mature in the hepatocytes. Now this matured and multiplied form will be called as merozoites. After significant multiplication, the hepatocyte is going to burst. When the hepatocyte will burst, it will release the spore, that is actually the multiplied form, matured form, that is now known as squizone. The blood form of the parasite is known as squizone. Actually, now after this release of the squizone in the blood, actual attack of malaria will start, and that is fever with chills. Now within half hour to 1 hour, these squizones will move to RBCs, and when they are moving to the RBCs, the clinical attack of malaria will go down. The patient will get settled after half an hour to 1 hour. Now parasites are there in the RBCs, that is the squizone is there in the RBCs. In the RBC, it is going to convert in male and female gametes. Now after some time, it will get converted into male and female gametes, and this RBC is not a normal RBC now because it is containing the parasite. It is containing the male and female gametes, and that's why when this RBC is passing through the the spleen is going to kill it, and this is how hemolysis will start. Now RBC is killed, the male and female gametes are there in the blood. Now fortunately, these male and female gametes are not going to produce any disease in the human beings, but are very dangerous. So far continuation of life cycle of malarial parasite is concerned. Now if a non-infected female Anopheles mosquito is going to bite me, it will suck the blood along with the gametes. There is multiplication of the fusion of male and female gamete in the saliva of the mosquito, forming the zygote. The zygote will be transferred to the stomach of the mosquito where it is embedded. And in the stomach of the mosquito, there is again multiplication and maturation. A small tiny spores will be produced out of this gamete. Multiple spores will be produced. And at one point of time, all this structure will burst. And now those tiny spores will come in the saliva of the mosquito. Now this mosquito can infect the human individual for the rest of its life. Getting it? Yes. Now very important thing. The first time when the mosquito bites me and the spores are released and trapped by the liver. In case of P. vivix and P. ovuli, not all the spores undergo maturation. In case of P. vivix and P. ovuli, Plasmodium vivix and Plasmodium ovuli, not all the spores are going to be developed into merozoites. Some of them remain there in the hepatocyte in the sleeping form. We call them hypnozoites. Now they are sleeping. They are not going to develop. Few of them are going to develop. They will produce malaria. While you are treating the patient of malaria, what you kill? Only blood forms. Hepatic forms you don't kill. And that's why when I am using chloroquine, I am using mefloquine, I am using sulfadoxine and pyrimethamine combination. I am just killing the blood forms. The squizone I am killing. All drugs are squizontocidal drugs. Those spores are there in the liver, sleeping there. Now you cure your malaria, clinical cure you take. All blood forms you kill. That's fine. The patient is okay now. But after 2 months, 1 month, 2 months like that, those spores can also develop into malaria. And this patient, without having any bite of the mosquito, will again develop malaria. This is known as relapse of the malaria. But this is possible only with the P. vivix and P. ovuli. Are you getting my point? Yes. This is important part of the life cycle of malarial parasite. Hope so all of you like the given explanation regarding the life cycle of malarial parasite. Unless and until you understand this cycle, you can't understand malaria. Second important thing. Now there are words used. Pre-erythrocytic phase means hepatic phase. This is important. Pre-erythrocytic phase means hepatic phase. It is also known as primary tissue phase. Primary tissue phase, hepatic phase, pre-erythrocytic phase generally indicates the initial phase, that is the phase in the liver. Then comes the second word, that is the erythrocytic phase. It actually means the blood forms. The squizone free in the blood and the squizone in the RBC. Both should be regarded as erythrocytic phase. And then come the last word, exoerythrocytic phase. The word exoerythrocytic phase is equal to gammatic phase. Exoerythrocytic phase is equal to gammatic phase. That is also known by the name secondary tissue phase. That is also known by the name secondary tissue phase. Hope so all of you are getting my point. These words are very important because when I will teach you the drugs of malaria, you will all require all these things because the drug acts on the specific part of the cycle. There also I first will explain the cycle and then we'll start the drugs. Everyone is happy? Now, next important thing. P. falciparum malaria is not showing you the classical picture of malaria. What is the classical picture of malaria? Alternate day fever is a classical picture of malaria. Most of the time it follows a specific picture. And what is the picture? Suppose today by 10 o'clock I am getting fever with chills. After by 11 o'clock I will be settled. Then tomorrow morning I don't have any issue. But a day after tomorrow, today is 23, na? 23 December. Today is 23, 24 I will not have any problem. And on 25, round about 10, plus minus half an hour, I will again have fever with chills. 26 I will not have anything. 27 again the same issue will happen. This is a typical pattern of malaria, alternate day fever. And that is why in Ayurveda we call it Vishamajvara, odd days. And that's why the words are Vishamajvara. But now Maharashtra government is very clever. Vishamajvara in Maharashtra government means typhoid fever. Why they call typhoid as Vishamajvara I don't know. And Hivatap is only malaria. This is a chart which I love because it is written very simply. See, all these charts are my brainchild. Mosquito bites to human being. It will release the spores in the blood of the human being. Those will be trapped by the liver. Very simple. It will be trapped by liver. Now what happens in the liver? Multiplication and maturation. Actually multiplication will take first and then maturation. I have written there maturation and multiplication. That is wrong. What happens? Multiplication will happen first. Then it will convert into maturation. Okay, not an issue. But at the same time, not all will be going there. But okay, I will continue with the first step first. Then it will be released into the blood. Those will be known as squizone. Before that, they are known as merozoids. Before releasing into the blood, they are known as merozoid. After releasing into the blood, they are known as squizones. Are you with me? Now this squizone will produce the clinical attack of malaria, that is fever with chills. Getting my point? That will remain for half an hour. Thereafter the spores, that is the squizone will enter in the RBCs. Am I right? In the RBCs, They actually in the RBCs they are converted into male and female gametes. Am I right? Yes. Now this RBC is a sensitized RBC. When RBC is sensitized, that RBC is going to break. Male and female gamete actually थोड़ा गोंधळ झाला है. It will first be converted into male and female gamete and then it is going to burst. Now the male and female gametes will be taken by the bite of the uninfected mosquito. That uninfected mosquito is going to suck the blood. Now the female Anopheles mosquito is having the male and female gamete that will fuse in the saliva of the mosquito to form the zygote. It will travel to the stomach of the mosquito. Well, it will get embedded. Again, multiplication, maturation takes place and it will burst. And it will come in the saliva of the mosquito. Those spores will be taken up, when the mosquito is going to bite the human being, it will release the spore in the blood of the human being. Those will be trapped by the liver. Liver is going to process them, multiplication and maturation. Here is the point. Some will remain dormant. Some will remain dormant. Those will not going to develop at the time when others are developing. Already I told you, most of the drugs you use are squizontocidal drugs. They call only this blood form. They are not going to touch to the liver. Are you getting my point? Yes. Getting my point? Yes. Then these are known as hypnozoids. And after few days, 10 days, 15 days, 1 month, 2 months, like that, it may again develop into merozoids and squizons. And again, this is will be called as relapse of malaria. This cycle is related with relapse of malaria. Relapse. It is related with relapse of malaria. Are you getting my point? Are you people getting my point? Is it clear to everybody? Yes. This cycle is a short cycle actually. You should remember my words. एवढं शॉर्ट आहे म्हणा. हां हे शॉर्ट आहे. ॲक्च्युली त्याला आणखीन स्टेप्स टाकता येतात त्यामुळे टाळलेलं आहे. तुम्ही नका टेन्शन घेऊ, मी बरोबर केलेलं आहे. Getting it? Yes. Is it clear to everybody? Yes. This cycle is very useful to explain the drugs. Getting it? Yes. Some spore may not undergo maturation to form the merozoids but remain in the liver in the silent state known as hypnozoids. This typically is seen with the Vivax and Vovuli type, and relapses are common with these species. Pathology. In its sporulation and gamete formation, RBCs are destroyed by liver and spleen. Agree with me? Yes. Now, when RBCs are being killed, what they contain, my dear students? Hemoglobin. RBC's major content is hemoglobin. It is having two components, globulin and heme. Now that globulin part of the hemoglobin is reutilized. That need not any destruction. It is directly reutilized. And the heme part has to be converted into bilirubin. Now point is important. This first form bilirubin is a water soluble bilirubin. Is a fat soluble bilirubin. That fat soluble bilirubin is also known by the name unconjugated bilirubin. Getting it? It is also known as indirect bilirubin. And liver has to convert it to the water soluble bilirubin. Getting it? Yes. Generally it happens in the body and actually no jaundice develops in a regular way. But if malaria is remain untreated, then more and more RBC will be killed. Heavy destruction will result into anemia as well as jaundice. This is the hemolytic jaundice. This is the hemolytic jaundice. Now, तुम्हाला काही समजणार नाही पण ते, but ठीक आहे. Now, how can I differentiate this jaundice from the regular jaundice? I should tell you, तुम्हाला समजण्याचं काही कारण नाही, मी समजून सांगतो. Now, my dear student, is the liver involved in this process? The answer is yes. Is the liver is having the disease in this process? Is the liver having any disease in this process? The answer is no. Liver is involved? No. Liver is involved. Is the liver is having disease? The answer is no. And that's why the liver enzymes will not elevate. What are the liver enzymes, my dear student? SGPT, SGOT. That is what we call blood transminases. Those blood transminases will not rise. Blood transminases will not rise. SGPT, SGOT will not rise because there is no destruction of any hepatocyte. As Guruvar आहे बरं का. You be very cautious today. Are you with me? Everyone is with me? Yes. And that is the major part of differential diagnosis. Patient had a fever. Patient is presenting with that is jaundice. Bilirubin is high, 4, 5, 6. Patient is yellow. But patient don't have rise of SGOT or SGPT. Actually minor rise is there, but major rise you can't see there. And that is the major part of differential diagnosis. Getting my point? Yes. It is not hepatitis. And that's why hepatic enzymes will not rise. Only bilirubin rises. And because of the destruction of RBC and because of this bilirubin issue, you will get hepatomegaly and splenomegaly as a complication of malaria. It is seen only after 1 week. Especially splenomegaly is seen after 1 week. That is an important point every student should note. It's not an immediate thing that you will find. Clinical features of malaria, nothing. I should tell you very clearly. Malaria will give you fever with chills. Second thing, in malaria, photophobia. Patient don't want light, just want to take the curtain. Third, backache. Excellent backache. बसायची इच्छा नाही होत पेशंटची. And headache is associated. Yes. Out of this, pure malaria sign is fever with chills. All other signs you will get in other fevers also. Photophobia is also a distinguishing feature. Photophobia is also a distinguishing feature. Getting my point? Yes. Patient don't want to see light. If this window is open, he wants to close it or she wants to close it. Getting it? Yes. Clinical features of malaria. Malaria is being characterized by fever with chills as the cardinal feature. Am I right? Other symptoms includes backache and photophobia. Headache is also there. Photophobia is a typical sign. Fever with chills is a typical sign of malaria. See, differential I love. I love differential diagnosis. P. falciparum produces a very atypical picture. This fever with chills and this typical one-day alternate fever and all that is not present in P. falciparum. Then you may ask me, sir, what is there in the P. falciparum? P. falciparum presents with continuous fever. Fever is not much. It is not high grade or anything. Drowsiness is a very important feature of that. And patient deteriorate fast. 5-6 days of this malaria P. falciparum may be fatal to the patient. And that's why early detection is very, very important in P. falciparum malaria. P. falciparum malaria very, very closely mimics typhoid fever. Because in the typhoid fever, you are having continuous fever. Here is also continuous fever. Fever fluctuates in P falciparum but never touches to the bottom. Generally, the fluctuation is in between 1 degree. It fluctuates, but not more than that. Continuous fever is there, drowsiness is there, and patient will die of multi-organ failure. She is asking me how it is possible, Dr. Joshi. The point is very simple. When the P falciparum is going to infect the RBC, the outer surface of the RBC becomes very sticky. And that's why there is the development of cluster of WBCs, cluster of RBCs. And that is going to obstruct the smaller vessels. And this is a very dangerous thing. She may be thinking, what happens? If it is passing through the renal vessel, it can block that renal vessel. The micro vessels of the renal tissue will be blocked and you will get micro infarcts in the kidney. Suppose same thing is happening in your brain, you will have stroke. If the same thing is going to happen in the heart, you will have myocardial infarction. If the same thing is happening in the liver itself, it will block the liver. Liver functions will be affected. This is a concept of multi-organ failure, MOF. And that is the main cause of death for malaria. Remember my words forever. Even with the well-equipped hospital, this case may not be saved. And that's why early diagnosis is the only clue that can save the patient. P falciparum kills the patient even in a well-equipped hospital like Dinanath Mangeshkar Hospital, like Ruby Hall Clinic, like Wadia Jahangir in Pune. Kills still today. That's why I used to say this malaria is a stigma on our society. डाग आहे आपल्या समाजावरचा. What's the problem? People treat only clinical malaria. Very few consultants only put the prescription for primaquine. Primaquine is the only drug which can eradicate malaria. Am I right? P. falciparum. This may be the fatal form of malaria due to the widespread resistance to this species. P. falciparum has got 100% tolerance, resistance to chloroquine. A very important drug in the treatment of malaria has got almost 100%. The symptoms are relatively mild. Malaria, P. falciparum. A typical pattern of periodicity is lost, is not marked. Temperature during the interval does not fall to normal. I already told you. Fluctuation is there but not more than 1 degree. The other parasite infect only juvenile RBCs, but P. falciparum can affect the RBCs of all ages. Negative point of P. falciparum. One RBC could be infected with more than one falciparum parasite, that is okay. The most important point with the P. falciparum is that the parasitoized RBCs are sticky, causing obstruction of the small blood vessels, leading to the vascular complications like arterial ischemia of kidney. This is the one example I have given. Arterial ischemia of the kidney, or what I am trying to tell you, is one example only. It may happen with brain, it may happen with heart, it may happen with liver itself. Multi-organ failure is the cause of death. Am I right? Anoxic state due to the congested and blocked capillaries with the parasitoized RBCs. The lesions are seen in the lung, brain, kidney, etc. Multi-organ failure. Am I right? Already I talked to you about P. ovule and P. vivix. Fever is seen before the classical attack of malaria. Agree with me? Getting it? Yes. Odd. The attack, typical fever is seen on alternate day, starting with the rigors. Rigors, what is this rigors? Great chills are known as rigors. High intensity chills are known as rigors. Rigors are seen only with malaria. Chills are general. Investigations in malaria. Blood for MP. What I am trying to tell you? Blood for MP. One very important thing I want to tell you. That is, you should take the blood when the parasite is there in the RBC, because the test indicates that, to tell you everything. Suppose this is the RBC. When it is infected with the parasite, you will get the dot like this or a dot like this, corner. Now this is the sign through which I am going to tell that malaria is present. Now all of you know that the squeezone enters the RBC, converts into male and female. It takes some time. Am I right? Yes. And this RBC will be killed. RBC will be killed while it is passing through spleen. Now tell me, my dear student, suppose I got malaria by 10 o'clock in the morning. Am I right? Suppose I got the malaria, say by 5 o'clock, which I had, and by 10 o'clock I am going to the lab for giving my blood. Will my RBC really contain the parasite? No, by the time that all RBCs will be killed and male and female gametes will be released. Then will you find this black dot in the RBC? The answer is no. The answer is no. And that's why your test for MP will be negative. Are you getting my point? Yes. And this is a common thing. And that's why test of MP is many times negative. Patient is having malaria. If you want to trap it perfectly, you should take the blood maximally within 2 hours of the fever. Actually, the right time to take it is just while it is happening, or just the patient is recovered. That 1 hour I am telling you repeatedly. That is the right time to take the blood. Then you will get many RBCs with this spot. You may be thinking, Dr. Joshi, how you know all these basic things? The answer is very simple. In PHC, you have to do it of your own. You have to take blood, take the smear. Smear ekdam sopa kasa. Very simple. You take the 1 drop of blood on the slide, take another slide. Gasa advi. Purr. Pani. Tap running water. Put it under microscope and see. So simple. And that is the method to diagnose MP in PHC. During malaria, you have to take that blood and you have to find out it. Rapid malaria antigen test. Plasmodium glutamate dehydrogenase is the enzyme. I should tell you the detail again. Now my point is very important. I want to detect the parasite. Am I right? Am I right? Yes. Now I am having one option is to go with MP, but MP is having its restriction that you have to take the blood during the malarial attack. Am I right? Yes. But its sensitivity is very high. How it is? Even though 5 parasites are there per ml, still it detects MP. Now, this rapid malaria antigen test, that is Plasmodium glutamate dehydrogenase, is the enzyme secreted by this parasite. To make it detectable, you need at least 100 parasite per ml. You need at least 100 parasite per ml. Now, very important thing I am going to tell you. People think that this is a very new test or advanced test. Am I right? Yes. This is the test actually developed for the people where malaria is there and doctors are not there. Even microbiologist is not there. Are you getting my point? Even microbiologist is not there. There, this test is used actually. You have to take the blood and positive negative is there only. Detection. But the detection is at that rate. And that's why this rapid malaria test, rapid malaria antigen test is not so good test because its sensitivity is much more lesser than MP, malarial parasite. Getting my point? Yes. But why it is famous is because that it doesn't require that typical 1 hour, 2 hour issue. You can take blood any time for rapid malaria test. That whatever I am telling you repeatedly that you require the blood to take for MP within 1 to 2 hours of the clinical attack of malaria, that is not the requirement for rapid malaria antigen test. Though it is having lesser sensitivity. Getting my point? Yes. Sensitivity is less. I have told you about details. Am I right? But it is still effective. Why? Because the blood can be taken anytime. Am I right? Yes. Now, if I ask you to find out malaria, which test would you prefer? Which test would you prefer? Actually, we prefer both of them. And if you ask me, Dr. Joshi, what is the real test of malaria, anti-malarial medicine? Thank you.